All right, we are live. Good afternoon. It is November 11th, Wednesday. This is our live session, educational session for bariatric surgery. My name is Kemal Erkan. I'm the chairman of American Surgery Center, as well as United Medical ACO. And I have Dr. Isais Irgau with me. He's our program director and head of our program on the Surgery Center side and the CHRIAS side. Dr. Irgau, how are you doing?
Very well, Kemal. Thank you. How are you today?
Good. Well, it's been a couple of weeks now. You and I, we didn't do a session, so I'm glad we were able to catch up. I'm going to actually start sharing my screen from one side. So I'm going to wait for Tanner to tell me that my screen is being shared. PowerPoint is on. Yep. So this is the program that the live educational session we are trying to adopt as a weekly discipline, and we've been actually since early summer we have been doing this, and I believe it gets a lot of good feedback from our patients, and the goal is to support our existing patients who already is going through the bariatric surgery, patients who may be thinking of getting bariatric surgery, as well as patients who already had bariatric surgery in the past, so then they can see different topics to support their perhaps day-to-day struggle related to what they are going through. The Surgery Center program, we are the leadership is right now with you, myself and Dr. Irgau, and the program is supported by CHRIAS, Christiana Institute of Advanced Surgery. CHRIAS is one of the most experienced bariatric surgery practice in the nation. And I have the pleasure of having Dr. Irgau on our side. And Dr. Irgau, if you can just briefly talk to us about CHRIAS, and then we'll just start the other stuff from there.
Absolutely. Thank you very much again, Kemal. And I want to thank everybody tuning in as well. So Christiana Institute of Advanced Surgery, or CHRIAS, is a practice that focuses on bariatric surgery. Really, that's the mainstay of our specialty. And we have been doing bariatric surgery now for almost 20 years. As Kemal mentioned, we are by far the most experienced practice in weight loss surgery or bariatric surgery. Myself, Dr. Gail Wynn, Dr. Michael Peters, Dr. Rahul Singh, Dr. George Ibrahim are the bariatric surgeons with CHRIAS. We do have Dr. Sachin Vaid as well, but he's a colorectal surgeon. But bariatric surgery or weight loss surgery is the mainstay of our practice. As I said, we are the most experienced, and we've really started and set up centers of excellence for bariatric surgery in our area's main health centers. And as well as more recently at the American Surgery Center, which, as Kemal mentioned, specializes in bariatric surgery. And the American Surgery Center actually is one of the very few ambulatory surgery centers in the country that is credentialed by the MBSAQIP and other credentialing bodies to as a center of excellence for weight loss surgery or bariatric surgery. I'm very happy to be here today, as in many other sessions, with my friend Kemal Erkan, who is the chairman of the American Surgery Center, really to expand the educational knowledge about weight loss surgery, which is so much needed in our society now, where many people suffer from morbid obesity and the ravages of obesity. And we're here really to tell them there is a way out, there is a way to take care of it.
Dr. Irgau, thank you so much for that introduction. We do go through some of our program members who are part of the process, and they help us greatly. And I do want to introduce our dietitians, nutritionists, Fran, Amy, and Beth. Mainly their practice is on bariatric nutrition and diabetic patients, and they are also part of the United Medical ACO, as the accreditation of the Diabetes Center is through the ACO. So we greatly appreciate their support and help. Today, we are going to discuss the idea that we were trying to have is, well, how can we actually deliver this information to our patients without overwhelming them? So Dr. Erkan and myself, we, as the leadership of the program, we spend a lot of time together in different meetings. And also I do have a team here who's helping us to make this technically possible. And I wish it was so easy to just have one person, but like 3, 4, 5 different people who are helping this process. Now, one of the things that we did is if we were to actually divide these into small topics, topic-specific, topic-targeted way, can we actually accomplish more with our patients in terms of giving the information and the support? And I think that is working out so far. And then today is our volume 11 that I'm doing this on outside of our webinars. This is also on top of that, this is what we are doing. So this is session 11 from that point. So someone who is already in the process or who's planning to go through the surgery, they can go to CHRIAS YouTube channel, and then they can get all the information on top of the support that they are already getting from the practice in the convenience of your own time. So that's what we are trying to do. So now, Dr. Irgau, again, giving this feedback and what we are trying to do here, but you know how this topic came about. So we are giving a lot of education again, a lot of support, but in some cases the patient perspective of real patient. Now our goal is to work with some of our patients who is willing to come and talk to us in live sessions, which we are in process of getting. But while we are doing that, while we are working on getting that, can we actually give some specific patient examples? And almost in a way, if we can discuss this in a case review way of okay, what would be happening to this patient. So that's what I prepared for us today. So that's why the topic is the way it's labeled. So hopefully we can accomplish this. So now going back to what we are discussing, there are so many processes that patients going through again. So I have 3 different patient examples for us, and we are going to ask Dr. Irgau what these patients are going through, what has happened to them. I picked these patients in 3 different stages. So here's our first patient. Dr. Irgau, this patient is, now it's a blind data. So this is a real patient, but it's not, of course, we are not gonna disclose the name. So I picked this patient because this patient just had a surgery in January 2020. Interestingly, this was patient's second time going through this process. The first time in 2016, patient couldn't complete the process. And during that time, her weight was going up. And actually, if we were to get it at that time, her BMI was around 47. When she came back to us second time, she was at 50.36 BMI, which is equivalent of 321 pounds with her height. Now, Dr. Irgau, this patient of ours, in 6 months time period, lost about 80 pounds. So I'm going to actually refer this back to you. If you can just tell us how we were able to do this. And now I have the other disease-related specific stuff for this patient, and we'll discuss that right after.
So this is actually very, very good, Kemal, because it illustrates a number of points that are so common to many patients who are struggling with obesity and morbid obesity. So as you mentioned, this patient have had their surgery in January. So we're about 10, 11 months out from the surgery. And you're showing that they started with a weight of about 321 pounds. And then over the past 10, 11 months, they've lost about 80 pounds, and now their weight is down to 239 pounds. And then you mentioned the BMI, or body mass index, which is a calculated number that takes into account the height and the weight of the person. And that number actually gives us a sense of how severe the weight issue is for that particular patient. As we talked before, there is a normal BMI, which is a BMI anywhere between 18 to 25. Then a BMI between 25 and 30 is classified as that person being overweight. Then a BMI between 30 and 35 is classified as that patient having class 1 obesity. And then a BMI between 35 and 40 is classified as class 2 obesity. And then a BMI greater than 40 is the definition of morbid obesity, as you know. And this person, as you can see, started with a BMI of 50.3, which is really on the high end. And their weight also is visible. Anybody could understand that the weight of 320 is really a very high weight for that person. So yes, they went through the process. They had the sleeve gastrectomy at our center, and they've lost all this weight over the last 10, 11 months. But what is also very important and should not really go unnoticed from what you said introducing this patient, Kemal, you said this patient actually approached our program in 2016. That's 4 years ago, right? And at that time, that patient's BMI was below 50. In fact, it was 46. And I have to guess their weight was probably in the 270 range at that time, okay? So at that time, that person entered our program, and for a number of reasons, the patient did not go through the surgery, right? But what happened in that missed opportunity? The patient's condition deteriorated, right? With the increase in weight that has occurred in those 4 years, that patient's health will also have deteriorated, because the weight increase does not only affect the quality of life of that person, it actually becomes a real burden for the health. Blood sugar goes up, high blood pressure goes up, sleep apnea gets worse, the risk of cancer increases, many other illnesses get worse. So one interesting question would be, why didn't that patient go through the surgery in 2016? So an important point that we have to remember here is that there is a bias against assessing obesity as a disease in our society. And that bias persists despite all the education we've had. For some reason, we think that people who struggle with obesity, they have to fix it themselves, because we have it in our head that it's their fault. It's lack of willpower that has caused that. Far from it. We know very well right now that obesity has to do with the biology of the person, particularly when the weight goes that up. So people feel guilty about having to go to surgery to solve this problem, somehow feeling defeated that they haven't done it themselves. So it's not unusual for us to see people approaching bariatric surgery and then having second thoughts about it and saying, okay, maybe I'll try one more time by myself. But it is abundantly clear for us that people struggle, they cannot do it, and then they finally come up with the surgery. So that was a missed opportunity, but then the patient came back, thank God. They had their preparation, they had their surgery, and now they are through a very successful path in their health, as you
But that's really kind of like the main problem that I see that right now, how these patients are not maybe getting help from not only from society. In some cases, I see from the primary care level, where we want our primary care to diagnose this problem, approach the patient. Even the patient is there for a different reason. I mean, you may not say this, but I'm going to say it. I feel it's very irresponsible for letting the patient go to your exam room if the patient's BMI is already over 40. So if you didn't address that, I think I have a problem with that. I'm going to say that, and I can say it now, because what you are describing, Dr. Gao, this is a disease that we are dealing with. It's not a cosmetic surgery. So now, right now, you can see on my screen, this patient came to us not only with the weight problem, but We have high blood pressure, we have high cholesterol, we have heartburn, we have sleep apnea. So all these problems came with the 321 pounds. So how can I not get this patient getting the proper help if I'm providing the care from the primary care setting? And I do want this to also reach out to those who are treating our patients, take care of these patients, and if the BMI is between 35 and 40, well, make sure that if they have comorbidities, they need help. And this is not an isolated example. So I didn't have any difficulty picking these patients, Dr. Irgau. So I just went in and just picked random patients. I just want to make sure that one already had surgery 9 months ago. So that's kind of like what we are dealing with. So now I want to ask you this. Now, what does this patient expect after they lost 80-some pounds? And then now, in terms of these disease-related issues, what do we expect to see from this patient?
First of all, I can tell you that he is a very happy patient. My encounters with this patient, 6 months, 10 months after surgery, a year after surgery, is a patient that is ecstatic because they have freed themselves from day to day having to carry so much more weight, right? I mean, if you and I try to carry 80 pounds on our back and try to go, a few steps, let alone, walk the whole day, we will not be able to do it. It's too much weight. And yet those patients are able to be free from that. So they are happy patients. But more importantly, as you said, because obesity itself comes with the baggage of many illnesses, those illnesses, as obesity shrinks, essentially those illnesses also improve. So it's very common for us to see patients calling us saying, "Doctor, I'm taking blood pressure medications that I was taking before my surgery, but now I feel my blood pressure is going too low because sometimes I feel even dizzy when I try to get up from a sitting position." And why is that? Because they have reached a point where they do not need those strong blood pressure medications. Those blood pressure medications may have to be discontinued or reduced in their intensity. Same thing with if we check their cholesterol level, if we check if they were using a CPAP machine for sleep apnea, they find that the CPAP machine is not necessary anymore because the sleep apnea happens to be one of the very early things that disappears when people lose weight. Now, so this is the reality, really, with many patients coming in to see us with their obesity and multiple medications that they have been prescribed to address those many illnesses. And then with one treatment, they're able to relieve themselves of this. Now, granted, surgery is something very serious. There's no question about that, right? It is a concept, is an idea that really elicits anxiety in everybody's mind when you talk about surgery. So my job, our job really is to educate patients and really figure out what are the long-term risks of staying overweight compared with the short-term risks of surgery. And we have to be able to quantify that for them. And we have to make sure we illustrate to them that the long-term risks of obesity far, far outweigh the short-term risks of surgery, which has been made to be so much safer nowadays, particularly in centers of excellence like ours. Remember, Kemal, we are able to do sleeve gastrectomy as an outpatient procedure for most of our patients nowadays, right? Which is something that we are able to achieve with a focused attention to every facet of the surgery. And we've been able to bring the safety level of weight loss surgery to levels of gallbladder surgery or knee replacement surgery, which are surgeries that we offer even to most senior people without any problem nowadays. So if the benefits of the surgery far outweigh the risks of the surgery, then the surgery is indicated. That is why the preparation for the surgery is so lengthy, because there has to be a preparation that allows us to have the patient really in the optimum state for them to safely go through the surgery. But also it's important that as they go through the process, the idea matures in their head that really surgery is the best option for them. In fact, weight loss surgery is not something that we can impose or push on anybody. People have to really be convinced that this is a beneficial thing for them. And they have to buy into the idea that with the surgery and the changes in their life, their outlook is going to be much, much better.
So, Dr. Irgau, the second patient I picked for us is someone who just had the surgery in September 2020. It's about 2 months, but the weight information I have is updated one is a month after the surgery.
Absolutely.
So this patient with BMI almost 42, with the height of the patient, it's about 260 pounds. So this patient in 1 month right after the surgery already lost 32 pounds. From 260 to 228, that's a big improvement from the like just a 1 month progress. Now this patient did have also other related disease such as high cholesterol, heartburn, and then on this patient we didn't have high blood pressure or sleep apnea or diabetes, but the high cholesterol and heartburn was part of the patient issues. Now, Dr. Irgau, from when we go back to this patient 6 months from now, what do we expect with this patient?
So absolutely. So this patient is very early after surgery. They are within the first, 30 days, and already they've done very well in terms of weight loss, and they will notice the changes themselves. Their family will notice, their friend will notice that there are changes physically, but also from an improvement in their overall health, there will be changes as well. Now, we will see improvements in their cholesterol level as they go through. Now, the heartburn is interesting that you mentioned, because some people who have heartburn, there is a possibility for heartburn to get worse, particularly with the sleeve gastrectomy, and that is something we discuss with our patients very often. Having said that, many patients who have heartburn, the heartburn is, if you listen to them, something that has gotten worse as they have increased their weight. So we expect that as they lose weight, what we call intra-abdominal pressure, which is the pressure of the fat inside their abdomen, will actually be less, and their heartburn will also improve. So as I said, there are some patients on whom heartburn can increase after surgery, but many patients who have heartburn will see improvement.
So, Dr. Well, I'll ask one of my non-physician questions. So heartburn, reflux, GERD, GERD.
Yeah.
So what's maybe you just said it, and again, sometime I listen to you, but then I don't know if you are not paying attention. Now you are emphasizing something here with the heartburn versus the reflux. So what differentiates those two the most?
So really, heartburn and reflux are pretty much terms that are used to describe a similar situation, right? It's essentially a symptom whereby patients, after they eat, they experience some burning, perhaps higher up in their chest and sometimes higher up. And that is the result of the fact that some contents from their stomach are being pushed up towards their food pipe. And because the stomach contents are acidy in their chemical composition, that acid actually tends to irritate the food pipe, and that irritation is felt by the patients. Very often patients will notice that after they eat certain foods that may be more eliciting acid than others. But very often, as I said, it is something we see associated with obesity, because obesity itself creates a situation where there is increase in the pressure inside the abdomen, which tends to push things upwards towards the chest where the pressure is lower. And as I said, with weight loss, that improves. In some patients, in a minority of patients, if the heartburn was so severe and there have occurred some changes in their food pipe of long-term exposure to acid, we may actually advise those patients to go a different route rather than the sleeve gastrectomy, maybe choose the gastric bypass as a potential option. But that is really not something that is the case for the vast majority of patients. But going back to what you were saying, essentially, even so early after surgery, patients will start seeing major improvements in their health.
So, Dr. Irgau, Third patient, again, like how I pick this patient based on when they had the surgery, or this one, in this case, this patient is going to have the surgery in December. The highlight of this patient is in the last 18 months. Right now, they're around 309, but they saw 348. That's a lot of weight, right?
Yep.
So now this is about 51.5 BMI. We're hoping that everything is ready for this patient. It's going to go on December 3rd. Now, of course, I don't have the after information, and then hopefully in the next several months, we'll be sharing some of these with our audience. Now, this patient, again, no surprise, a lot of related disease, high blood pressure, and sleep apnea and diabetes. So it's never, obesity is never by itself. It always comes with different diseases. In many cases, it's the reason, the root of the problem is the obesity. It's not something that you are diabetes and then you become obese. You have obesity and then you have diabetes. So now for this patient, all three of the patients, they have some similar problems, but they have some, they're not same. So based on the BMI and everything that changes. So what would we expect from this patient after the first couple months, Dr. Irgau? So
again, a patient with a body mass index of 50, a patient whose current weight is at least 130, 140 pounds higher than their ideal body weight, you would expect them to have these medical conditions, the high blood pressure, the sleep apnea, the diabetes. And what we are planning, obviously, is to do the surgery and have that patient start losing weight so their health trajectory changes fundamentally, right? So if this patient were to continue where they are right now without the surgery, right, 10 years from now, not only their weight will be higher than where it is, but those conditions that you've shown here, they will be worse than they are right now. So if they are on one medication for blood pressure, they may be on 2-3 medications, right? If their diabetes is being controlled with one medication, they may require more medications in 10 years' time. Their sleep apnea will not relent, will become worse as time passes, right? But they may develop other medical conditions as well. So their path is set by obesity in a very negative way. They will develop more and more illnesses, right? But we are changing that path with the surgery, right? They are losing weight. So now they have a completely different outlook from 10 years from now, right? We will help them lose the weight, we'll help them keep the weight off, or most of the weight off, and those illnesses that have crept up will be going into the background. So the health profile of that person 10 years from now is completely different from the path they are on right now without the surgery.
So like they won't have these related diseases. The only big problem they will have is excess skin. So then
excess skin is something that many patients, actually, it's very interesting you brought that up. They ask about it, right? Particularly in patients where the fat accumulation is right underneath the skin. As they lose weight, obviously, the skin doesn't retract anymore. The ability for our skin to retract is lost in childhood, so there will be excess skin. And for some of our patients, this means, going on to have some plastic surgery about 1.5 to 2 years after surgery in order to, get rid of the excess skin, which sometimes by itself can cause problems like irritation, rashes, and so forth.
So, Dr. As I mentioned in the beginning, we are hoping to get some of our patients, well, because it's a sensitive issue, I think discussing this in front of public sometimes is difficult, but I have a couple of our patients already have some commitment to us. So even if it's not live, we'll have a video where we're going to bring them into the live video. So before we close our session, one of the things that I do want to again mention is the digital health with COVID-19 pandemic we are going through. is something that is maybe the silver lining from this pandemic that we are having. So if we didn't have this pandemic, perhaps we were not going to have this program today. So we were going to have our in-person seminars once a month. And now we are in front of our patients on a weekly basis, sometimes more than once. And I think it's something that we will keep it permanently, and then we'll make ourselves accessible for our patients. Now, we are including the access and the channels. One is like, again, without the patient portal utilization, we won't be able to do a really good quality telemedicine. Please, our patients, our prospect patients, make sure you activate your patient portal with IQ Health. And also, here is just like a screenshot of our channel with CHRIAS. We are spending a lot of time to make this as easy as possible, as easy to access, so that you can actually watch these. You don't have to watch it live, but on a weekend, if you need to, if you are doing yard work and then you play this on your phone, it's still it's going to still help you. Now, the team that we have, there are so many people every day we are meeting. This is not something that happens in other programs. And I do have to emphasize that, because that's something Dr. Irgau and I, we advocate for a long time. To every program that we were in, we said, okay, this patient support has to be at a greater level. But once we have our freedom in our surgery center and the program that we are managing at St. Francis, we do have our daily case conferences with our multiple different people from different aspects of the patient management. And the help is available, help is there, and we are here to help you. Our goal is to make this, again, as seamless as possible. And, at this point, taking advantage of these is going to be the next step that you need to take from the patient standpoint. So, Dr. Irgau, before we close, any closing comments that you have?
Thank you again, Kemal. This is very important. It's very useful, particular discussions like today, where you brought real patients that reflect what's out there. Essentially, a lot of people struggling and perhaps not being able to relate because they're not, seeing something that we are presenting today. So I hope this is going to help many people to understand what obesity is, that there is treatment available, that they have a wonderful program, in our program, in taking them through safely and to really get them to recapture their own life again.
Well, we are happy as well, Dr. Irgau. I do actually, personally, I enjoy having these sessions. I believe that the feeling of accomplishment and doing our obligation for our patients and society, actually, it's not just for our patients. I believe it does help me to feel better. So hopefully everyone else feels better as well. Well, thank you for being with us. We'll be back next week. This Friday, we have a session from United Medical ACO. And then actually tonight, there is a diabetes wellness program session with Dr. Barnett Smith from United Medical Clinic. So that's at 7 p.m. right, Tanner? So, and then Friday event is at 12 noon. We'll see you. Bye-bye. Thank you.
Bye. Thank you. Bye.